I think the time is up, and it's really my great pleasure to give you a presentation on the climate change and the health interlinkages. And first of all, I would like to say good evening, good morning, and good afternoon to all the students. So it's really glad to see you virtually in this wonderful course. I will introduce some of the rules for today. First, I will give a 1 hour lecture, and I would really encourage you to type in your questions anytime into the chat box. And then finally, we have about 15 minutes to for questions and answers. And I would also encourage you to raise your hand and to raise your questions by opening your camera and to opening your mic. So let me also introduce myself. My name is Wenjia Cai, and I work in the Department of Earth System Science in Tsinghua University. And my research interest is to model and to evaluate the impacts of low carbon transition. So carbon neutrality is something we are really keen to explore in our projects. So today I'm going to take you through the health impacts of climate change and the carbon neutrality. Apologize that I only have the this graph for China, but I believe most of us today can see more frequent and more intense extreme weather events that are happening all around the world. So let's just take China, for example. We have this in January in South China, those record-breaking cold spell. And actually this year, a lot of people are worrying whether we will have an extremely cold winter in December or in January. So we are starting to worry about those upcoming extreme weather events, and that's something never happened before. And also in February, in north part of China, where it used to be very cold, about 1/4 of cities in North China have those record-breaking daily maximum temperature, which means they never had such high temperatures before. And also in March, if you remember, we have these sandstorms in north part of China, affecting more than 10 provinces and billions of people. And also if you remember, also in May, we have this marathon games in Gansu province. And when these top runners were joining these marathon games, they met with this extreme hail and ice rain, and which leads to the deaths of more than 20 people. And they are almost the top marathon runners in China, and which is really sad. And if you live in China, you can't miss the biggest news in July, which is the extraordinary precipitation in Henan provinces. They said it's like a once in 1,000 years rainstorm. So the whole city, and actually several cities in Henan, are just buried underwater. And also after that, we've also seen like record-breaking precipitation in Shanxi and the Shanxi province. So you can see there are a lot of news focusing on these intense extreme weather events in China. And what are these like temperature change and also the extreme weather events relate to us? I think most of us, I mean, everyone on this planet, they care about the health of themselves and as well as their parents and their children. However, although most of us are thinking that our health are determined by like the food we take every day and the exercise we take every day, and even the mood we have, whether we have good friends and good working environments. But a lot of people don't recognize that climate change is actually affecting each one of us health from various ways. So you can see from this graph, and this is a graph which was published in the Lancet, which is the most prestigious medical journals in the world right now. So it was published in 2015, which summarizes the direct and indirect links between climate change and health. And you can see from this graph, what are the phenomenon of climate change is that we are having more and intense storms, droughts, floods, and heat waves in everyday life. And these meteorological phenomenon will have the direct effects on the health. For example, some people would have their more incidence of those cardiovascular diseases or respiratory diseases. And these are the direct effects. And if we look at the indirect effects, we know, for example, air pollution is a serious environmental problem faced by many countries in the world. And actually, climate change have an indirect effect on air pollution. Sometimes, while most of the existing literature says that climate change will lead to more stabilized atmosphere in the future. So even if we emit the same amount of air pollutants, we will have much severe air pollution. So that is why it will also, climate change it will act like an invisible hand and will jeopardize our health from different ways. And another thing is ecological change. Probably most of you or some of you are not familiar with ecological change. But if you look at the spatial distribution of mosquitoes, you would see the trend, a very clear trend, that mosquitoes are moving north and their survival duration during a year has been extended. So, for example, in Beijing, you would probably still see a mosquito in November, and you could imagine to see a new mosquito from like April or even earlier in Beijing. So, supposing that we are living, or actually we are living in this warmer world, and can you imagine that in Beijing, we will meeting with those annoying mosquitoes for all around the year. So that is something we are expected to see in the future. So I am showing some of the graphs on the statistics or the real data for the impact of climate change on health in China. The left figure shows the death risk of heat waves. And if you look at this curve, this U-shaped curve, the horizontal axis means the temperature. So it starts from minus 10 degrees to Celsius degrees to more than 30 degrees in China. And then the vertical axis means the relative risk of death. So the higher the relative risk of death is, there is a higher possibility for those vulnerable people to meet with problems that has a life issue. So that actually damage leads to the death of these people. So if you look at this graph, this looks like a U-shaped curve. And what does it mean? It means that the lower the temperature is, the higher the death risk is. And also, if we look at the right part of the curve, the higher the temperature is, also the higher the death risk is. So if we go, if we're aiming for like a warming world, we will see more temperatures happening in this part of area. And we will have less cold events, although sometimes we still have this cold spell, which means the the weather is extremely cold, but you see the curve, this right part is rising more rapidly than the left part, the cold part. So that is why if we combining like the less cold related deaths and the more heat related deaths, the warming world will actually lead to more temperature related deaths. And the right figure actually shows the death risk of heavy precipitation and typhoons. And this is a graph showing the death risk in Beijing I can't remember which year it is, but we had like also once in 100 years precipitation, which leads to more than 60 people's death. And during that heavy precipitation event, we will see there are a very obvious increase in the accidental mortality. And also some of the other mortality rate are also increasing rapidly. So the key messages from these two figures is that the impact of climate change on health is unequivocal. We have a lot of evidence to show that climate change has a serious impact on health. And if you still don't believe from those single graphs, let's see this global burden of disease studies results together. You know, global burden of disease is like a giant project which combines the efforts of more than 1,000 scholars around the world. So what is the global burden of disease? It actually shows why are the people in a certain country is dying from. So for example, in China, we have a lot of people who are dying from diabetes, from lung cancer, from stomach cancer. A lot of these kind of factors are leading to the death of Chinese people. So this graph actually shows the several categories of deaths, of factors that leads to death. So you can see a lot of people actually are dying from the metabolic reasons. For example, they have high blood pressure. They have high BMI, or meaning they are too fat, have obesity problems. And the second reason, or the largest reason, is because they are having behavioral reasons. For example, if they are smoking, they have a higher risk of dying, and also the alcohol use, and like you have a not very healthy diet. And for a lot of the students or a lot of the people at the working age, they are a lack of physical activity, and these are all leading to the death of Chinese people. And these are something that these two greener parts are something we're very familiar with. However, if we look at the light green part, which is the environmental part, I don't think a lot of people are familiar with that. So let's together see how what are these environmental factors. And you can see from this decomposition of those environmental factors. So among all the factors that belongs to the environmental factors, air pollution, that most of us are familiar with, are contributing the most. So about air pollution, we are referring to the particulate matter pollution and also the ozone pollution. Well, so these are something that we are familiar with. But let's look at the second largest part, which is the non-optimal temperature. That is something I just explained in the U-shaped curve. So if the temperature is very low or is very high, we call it the non-optimal temperature. So this part actually are taking up a relatively large share in the total death risks of environmental risks. So this part, this part already takes up like a quarter of the whole deaths in the environmental related deaths. And if if we look at this figure from a dynamic point of view, I don't know, well, how many of you are living in China, but if you live in China, you can feel this vividly, or from your eye, that the air pollution in China is improving a lot. And we are having more and more blue skies every year. So if dynamically, I would say the health burden from the air pollution is going down. However, the non-optimal temperature events, they will, the days that we have this non-optimal temperature will be like more and more than what we had before, because we are having this global trend of warming. And it is not like the air pollution that China can determine the trend of the improvement or the rate of the improvement. The temperature thing is like a global issue. It can never be decided by one single country. So it's like a joint effort from the world. So if we don't achieve like the temperature rise limit goals in the Paris Agreement, we will have a soaring, which is rapidly increasing temperature in the future. And you could see, and you could imagine that this part of the health burden will increase in the future. And actually the point I made here is that those non-optimum temperature is only a small part of the health impacts of climate change, just as I mentioned in the previous graph. So climate change is actually affecting our health from many different ways. So these graphs are actually underestimated the health impacts from climate change. And that is why we should really think or take this issue seriously, and to give more focus to the health impacts of climate change. Here I see some country level comparison. If you look at China, we have more than 10% or 12% of people who are already defined as older population. And in Japan, the aging rate is much higher than before, than the other country. They have like 1/3 of population who are over 65 years old. And in South Korea, the aging ratio is a little bit more than the China's statistics. However, if you look at here, the ratio of heat-related deaths in total deaths, it means that among each 100 people who died this year, around 1% of the total deaths are related to heat. It doesn't mean that they live in extremely hot events and they are too hot, and that gives like immediate deaths of these people. These people are usually having those preconditions in they have some existing health problems like the cardiovascular disease or some respiratory diseases, and he's just like a catalyzer for the incidence of these kind of diseases. So around 1% or more than 1% of the total deaths are heat-related deaths. And if we look at this figure, you can see the ratio of heat-related deaths in total deaths in China are increasing. Although it's fluctuating every year, but it's increasing steadily. So this actually echoes what I just mentioned, that the health impacts of climate change will keep increasing if we don't stop the current climate change trend. So in one sentence, no country is immune to the health impacts of climate change. No matter it's rich country or it's poor country, no matter it's some country, inland country, or any country that are located along the seashore. So different countries are facing with different kinds of health threats. And that leads to the introduction to a series of flagship publication on the health and climate change issue, which is the Lancet Countdown Report. I have the honor to join the Lancet Countdown Report since 2015. And 2015 is the time that we have this systematic review on the global trend of climate change's impacts on health. And since 2016, we actually set up an indicator-based monitoring system that tries to monitor the health impacts of climate change and its responses. By responses, we mean the mitigation action and adaptation action, which I believe you already know some from the previous lessons. So starting from 2017, we are using this indicator system built in 2016 to carry out those independent evaluation or quantitative evaluation on how the health impacts from climate change is changing in every country in the world. And now we are reaching to the sixth global report, and also the second China report. Actually, I am the lead author or one of the lead author for the China report, and we started doing it from 2020, when everyone is actually locked up in their room and can't go to their offices. So we really had a difficult time to carry out this joint work. And for the 2021 report, we are the authors comes from 25 leading institutions around the world, and not only from China. We also have some collaborators from outside China. And we have 88 authors who have contributed to this joint effort. And we have set up 35 indicators, which tracks like the heat wave related deaths and the health impacts from extreme weather events, and and also like the wildfire exposure and how it impacts the human health in China. So, and this is from the impact side. And if we look at the response side, we have also tracked like the coal phase out process in China, and also the investment into the renewable energies in China, and whether it is increasing, whether it shows some positive signs. And we are also tracking like how many people in China are exploring, are interested to know the linkages between health and climate change. So the overall objective of this report is to track the health impacts of climate change and the response measures in China. And we plan to update this report every year with provincial details. And this report has just been published on November the 8th on the Lancet Public Health. And just to, and this year we had a really good launching event. We have been supported by our university, the Tsinghua University, and you know that 160,000 people watched our live broadcast to this report. So just as I mentioned, there are 5 working groups of Lancet Countdown. The first one, or the center one, is the health impacts of climate change. And the second one is health adaptation, how we adapt to climate change and to adapt to those health risks. And the third one is the health benefits of mitigation or greenhouse gas emission reduction. And the fourth and the fifth working group are working on the economic implications of climate change and whether people are engaging more in the climate and health issue. So these are the 5 working groups. And if we look at or the indicators, and this slide shows the 2021 reports indicators. So we had, just as I mentioned, we have this health and heat relationships, health and extreme weather events relationships, and this one is the climate sensitive infectious diseases. In this indicator, we are tracking the incidence and the health burden from the dengue disease, which is a key disease transmitted by mosquitoes. And as I mentioned, there are the adaptation part, mitigation part, the economics part, and also the engagement part. And those blue indicators marked as blue is the new added indicator in this report. And actually, we have three key messages in the 2021 China report. The first one is China's health risks from climate change are increasing. And it is actually being seen in all around the world. And without timely intervention, extreme weather events such as the rainstorm in Henan province will become more frequent and more intense. And the second one is China has made important progress in addressing many aspects of health risk of climate change, but there is still room for improvement. And the third one is addressing extreme weather events is like a compulsory course for every department and every person. I mean, for students today, you all have compulsory courses to attend, and you can also choose those courses freely according to your own interests. But for the climate change issue, I mean, addressing those extreme weather events is something that every department and every people needs to do. It's not just about the ecology and environment ministry. It's not just the obligation of the Chinese Meteorological Agency, or it's not something that a single department could address. So it should involve the efforts from every department and every person. So let me show you some data or statistics on how these impacts are changing. So you see from this graph, China's health risks from climate change are actually exacerbating in the past 20 years. If we look at the heat wave related mortality, it has increased by more than 90% in 2020. If we compare to the 1986 to 2005 years average. And also the vectorial capacity for the transmission of dengue are also increasing. What does this mean, vectorial capacity? It actually shows the biting rates of mosquitoes. So when the temperature warms up, the mosquitoes will become more active than the low temperature scenario. So it will, it has the trend to bite more people in an hour. And actually that speeds up the transmission of dengue diseases by mosquitoes. So in China overall, the vectorial capacity has increased by 25%. And also it shows the same trend in wildfire exposure. And if you look at here, you will see, you will be like feel interested because we see some decreasing trend in flood and drought. But you know, we had really serious precipitation and also floods in 2020 and 2021. But we are limited by the most updated data shown in Chinese statistics, and that is why we only have the data for 2018. So it actually didn't represent the most recent trends in China. So if we include the 2020 and 2021 flood trend into consideration, I think it will reverse this trend showing on this graph. And another minor key messages is that each province in China, I mean, it's similar to for other parts of the world, which means every country faces their unique risks. But for China, we are such a large country, and each province in China, they have different climate conditions, they have a different number of population, and they have a different aging rate. So each province actually faces unique climate and health risks, and we are calling for targeted response strategies. So let's see two examples. For example, in Beijing, we have observed two related health risks that have a more than 10% growth rate in the past 20 years. So the first one is the population affected by flood, which are increasing which have been increasing by 1.7 times than the past. And also the vectorial capacity for transmission of dengue has increased by 67%, which is higher than the national average, if you remember just now, which was 25%. And in Guangdong, we have observed not 2, but 5 health risks, climate-related health risks that are increasing rapidly. For example, the heat wave-related mortality, they have increased by amazingly 24 times than before. And wildfire exposures have increased, population affected by drought have been increased, and also the vectorial capacity for the transmission of dengue by mosquitoes have also increased. So you see different provinces, they have their unique climate health risks. So it means that we cannot issue those identical policies for every province. Every province needs to understand their own climate health risks, and they can focus their limited financial resources and human resources to tackle these challenges. So now I would like to invite all of you to participate in this polls. My question is, in Guangdong province, it has on average 6.27, or you just remember it as 6 heat wave days during the past. And how many heat wave days do you think Guangdong have in 2020? So I would like you to take the following 20 seconds to fill in the polls. If you see a pop-out window, please click on the options showing on the pop-up window. You have 20 seconds. If you have difficulty for filling in the poll, please tell me through the chat box. Well, interestingly, I hope you can also, I hope you can all see, sorry. I hope you can all see the screen on the polls results. About 61% of our students today have voted for more than 20 days, and 36 have voted for about 10 days, and only 2% have voted for about 5 days. And I would like to congratulate the students who have voted for C, about 20 days. So you see how large the growth rate is among the past, during the past. Thanks for your participation in this poll. And remember, we will have another poll in the following slides. So in the previous slides, I have talked about the health impacts of climate change. But, you know, we have already done a lot of work to address climate change in China, and it has already had a very obvious health improvement effects. So the important progress in China could be seen in the low carbon investments. So even though we had those COVID pandemic during the 2020, the low carbon investment have still increased from in the past, so, which are now already 9.5 times larger than those investments in coal. And also the premature deaths, or let's say the air pollution related deaths, are continuing to decline. If you know about the health burden from air pollution in China, it is around 1 million people. 1 million people are dying from related reasons from air pollution. And during the past, from 2013, when we had this really strict air pollution control measures in China, the death related to air pollution has decreased by 25%, which is a big improvement. But even though we have these important progresses, we still have room for improvements. For example, in the carbon emissions perspective, although we have been impacted by the pandemic in the first quarter of 2020, our overall carbon emissions in the first quarter has decreased by 11%, which is a dramatic decrease. However, for the whole year, which include 4 quarters, the overall carbon emissions in China increased by 1.2% in 2020. So even though we had such a difficult time, the whole carbon emissions still goes up. And even though we have this big improvements in air pollution control, 98% of Chinese cities still have those PM 2.5 concentration that are higher than the WHO guideline standards. So a lot of people still are living in those cities which haven't met with the WHO standard. And also from the adaptation side, a lot of provinces that we made these questionnaires to them, and they have reported that they have completed or developing a provincial level adaptation plan for the health risk of climate change. And we've seen growth of urban green space in about 18 provinces in China. And also there are rooms for improvement. Let me just mention one. If you remember in this year, in April, in China, we have established a new bureau, which is a very high, a vice ministerial level, bureau, which is the National Bureau of Disease Control and Prevention. As everyone can see, this bureau is to prevent the diseases and to control further diseases, especially those infectious diseases. However, in the responsibilities of this newly established bureau, there is no reference to climate change. There is no reference to climate change because they literally don't see climate change as a health threat. So it is quite, disappointing somehow that they didn't see the climate change as a health risk. And we know from the previous slides that climate change is actually posing a lot of threats to human health, and that is something we should try to prevent. So we are actually right now we are making connections with this new bureau and try to convince them to include climate change into their responsibilities. And this graph shows the adaptation actions at the provincial level. The left figure shows which provinces have the largest number of indicators that are rising rapidly. So these colors in dark purple, they are those provinces that are having more indicators with high growth rates. However, if you look at the climate adaptation actions in those provinces, some other provinces are actually having more adaptation actions. Those dark and light green provinces, they are doing like a better job than those in white, those provinces in white. So you see from this two, if you compare these two graphs, you would see the spatial distribution of those dark colors, they have some mismatch. You know what I mean? those provinces which have more climate change health risks, they should have more climate adaptation actions, but they obviously didn't. So this spatial mismatch has implied us that we have a lot of work to do in the future to address these implementation gaps. And we have also tried to look at what's being done in other countries in the world. And it seems that a lot of the developed country, like the United States, like the UK, like the Germany, like New Zealand, France, and Italy, they have started or they have been doing a lot related to address the health impacts from climate change, starting from the impact assessment, the impact projection or the forecast, and also making the climate change and health adaptation strategies. So, however, these actions are not in the responsibilities of our national health commissions in China. And also in the developing countries, some countries are also doing a good job in the scientific assessment part. So there are actually a lot of work for us to do. And, you know, the climate resilience of healthcare systems also needs to be strengthened. What does climate resilience mean? Climate resilience means if we are meeting with climate change or sometimes the extreme weather events, whether we could have like enough capacity to address these challenges or to survive in these threats or to recover from the threats. So the climate resilience means the healthcare systems should be able to address those extreme weather events and to recover quickly. However, if you look at this side, I did have a photo showing that a hospital in Henan province buried in water, and people are using those boats to transfer patients out of the hospital. So you would imagine that under those extreme weather event situations, you would imagine hospitals to be the center point to rescue people. However, in this situation, you see those hospitals have become the places which are asking for help. And you know, in this hospital, they have put a lot of expensive machines on the B1 or even B2 floor. So when the flood came, a lot of those expensive machines have been buried in water, and the machine just cannot work anymore. So the direct economic damage to this hospital and also to the whole Henan's health system was initially estimated at 4.1 billion Chinese yuan. So that is really sad news. The healthcare systems in China is really fragile to the climate change and to the extreme weather events. And in fact, the World Health Organization has already published a lot of guidelines to help increase the climate resilience of healthcare facilities. So there are already a lot of learning tools for us to read and to practice. So from the previous introduction, we have summarized several policy recommendations, such as we need the involvement of every department and the cooperation among different departments in China. And we need to do more assessments of the health impacts of climate change and make those specific or targeted response strategies for every region. And we need to strengthen that climate change and climate mitigation actions have taken into account the health impacts of climate change. So we know that these actions needs to be urgent and needs to be ambitious. And we need to increase the awareness on this issue at all levels, not only at the public level, but also our department and also at the government, the high level decision makers in China. So to summarize is the challenges we're facing. The first one is that the climate change is actually taking the forms of extreme weather events. So we've seen a lot of weather events in the past when we have very few or very little climate change. But as the climate change trend worsens, we will have more weather events or extreme weather events. However, this climate change is hiding behind them. So that's why it usually makes people ignore what are really driving those more frequent extreme weather events. And the second challenge we're facing is that the health impacts from climate change is rising up in a fluctuated manner. So you have seen some of the curves which I showed before about the heat-related mortality rate. So it goes up in a year and then comes down in a later year and then goes up. So sometimes people would look at this decreasing trend and starting to question whether climate change is real. So that's also something we have been asked a lot during the communication to the common people. And we will have more and more extreme weather events that are hard for people to tackle with. And the fourth challenges is that all the impacts will be region specific. So we really can't find like a silver bullet for every region. And the fifth challenge is that some of the rare accidents for some regions will become more frequent in the future. For example, we know that typhoon usually attacks the south part of China, but in 2020, 3 typhoons have unexpectedly attacked the northeast part of China, like Jilin, Heilongjiang, and in northeast part of China, and that actually poses challenges to the adaptation capacity in this region. And the fifth challenges, it certainly is not the last challenges, but it's the 6 challenges that I could summarize, is there are no quick fixes. Because, for example, for COVID, you have those quick fixes because you can lock down the whole city and there is no conditions for the viruses to transmit. But for climate change, you really need to act now, because the temperature, the whole climate system has this strong inertia that you have to act now and you will see the effects in like decades. So that's something we really need to take into consideration. We shouldn't really delay any decisions. So here comes the second poll. So just now we know that Guangdong has on average 6 heatwave days during the past. And now we are looking into the future. Assuming that we are having this 2-degree warming scenario, let's try to envision how many heatwave days do you expect in Guangdong province to have at the end of the century, which means 80 years from now. So you have 3 choices, more than 50 days, more than 120 days, or if you're not sure, you're certainly allowed to vote for not sure. So you have 20 minutes for, 20 seconds to answer the question. Wow. Interestingly, about 34% of participants today voted for more than 50 days, and more than 40% voted for more than 120 days. And let's together see the magic ball. So we have this projection studies that have been done widely in China, and it shows that by year 2100, some cities in eastern and south part of China, they would experience more than 180 days or even 210 days of heat wave days in a year. What does heat wave days means? Well, although it means different definition or different conditions for different regions, but usually we could say like continuously 3 days of with the daily temperatures higher than 35 Celsius degrees, we could define it as a heat wave days. So you could, can you imagine living in a city where there have been like half of the days, half of the year, you are staying in such a high temperature. And just now we mentioned that it is the 2-degree warming scenario, which are shown here. The RCP 4.5 scenario, which is about 2 degrees. So you can see in Guangdong province, some parts of the province will have more than 180 days more heat wave days. And if we don't do any climate action, we are aiming for the RCP 8.5 scenario. And you see a large proportion of China is covered by this deadly red color. So the future will look very similar to what I have just mentioned, not only from the heat wave, the heat-related excess mortality that are increasing rapidly, not only because of climate change, but also from the population changes, which means we're having a really strong aging trend. And also, if we look at the high temperature subsidies, it is something that we are paying for those workers, especially outdoor workers, when they are working in the high temperature conditions. So it is requested by the government to pay for these outdoor workers a certain amount of money to subsidize their health outcomes under the high temperature situations. And this study is published in the Proceedings of National Academy of Science in the United States have estimated that the share of GDP devoted to high temperature subsidies could become as high as 3% at the end of the 21st century. 3%. We are actually like investing a similar amount of GDP into education. So you could see how large these amount of high temperature subsidies would go to. So the final part of my presentation would be linked with how does mitigation affect health. And there are actually a lot of channels that mitigation could affect health. For example, something we're most familiar with is that mitigation usually requires the phase out of fossil fuels. So the reduction of coal use, the oil consumption, the natural gas consumption, and that all leads to the reduced air pollution levels in this country. So by reducing air pollution, that will have very immediate health impacts to improve health. But also in the long-term perspective, it could help reduce the high temperature days, such as the heat wave days, and also reduce the frequency and the intensity of flood and drought, and cold spell and hurricanes. So these all belong to the long-term effects. And a lot of people are, a lot of the current literatures are focusing on the air pollution. And many modeling studies have shown that the health risks, the health co-benefits from reduced air pollution would outweigh the mitigation cost, And in China, it is especially so, because in our study, we have estimated that in 2050, the overall health benefits would be equivalent to 3 or 9 times of the mitigation cost. So it means all the mitigation costs could be offset by the health co-benefits. And there are other ways that health mitigation could affect health. For example, to reduce the vectorial capacity of mosquitoes. And this graph showing that how many less dengue fever cases would be happening in Latin America in a less warming scenario. So we all know that China has published this carbon neutrality goals in 2020. And in this study that we published this month, we have explored how the carbon neutrality pathways would impact human health. And this is actually belongs to the short-term health effects from climate change. We modeled how the climate neutrality goal would help reduce the air pollution in China and then leads to health benefits in China. But in this study, we have innovatively explored 2 different pathways to realize carbon neutrality pathway, carbon neutrality goal. The first one is we could try to use more renewable energy to reduce those so-called positive emissions, because we know that carbon neutrality means the positive emissions could be reduced by the negative emissions. So they achieve like a balance. But the other pathway is to increase those negative emissions, which we use, for example, the biomass or the agriculture or the forestry management tools to increase the carbon sinks in the current climate system. Or we use carbon capture and storage to storage these emissions from the atmosphere. So they have actually trade-offs. The first pathway, they are encountering huge transition pressure or huge transition cost, because we know to use renewable energy to replace the current fossil fuel, we need to close down a lot of plants in China and to force them to use new technologies. And that will cause a huge amount of cost of emission reduction. However, if we let them stay as what they do right now, we need to use more negative emission technologies to offset their emission. But in that way, we will allow them to continuously emit those hazardous air pollution. So that will emit more air pollution than So that causes health problems. So in this study, we want to find out what are the differences in the abatement costs and health co-benefits of different carbon neutrality pathways in China. And also, because all the previous studies, they have estimated like they are describing the health co-benefits of carbon mitigation as the reduced deaths from the carbon mitigation. So we could say like 1,000 people are saved, have been saved, their lives have been saved due to the mitigation actions. However, it's really hard for common people to understand. So we have, in this study, we have innovatively interpreted this number to the impact, to the life expectancy of the average people. So that is something we're doing innovatively in this study. So I will go directly to the results. So in short term, if we combine the climate policies with strict air pollution control policies, we could effectively improve the air quality in China. You can see from this figure, these 2 columns shows the 2035 air pollution level, and these graph shows the 2060 the air pollution level in the 2060, and a lot of the regions are less than 10 less than the WHO's recommendation level or the guidelines standard. So in the long term, the effects will be much obvious. And we have also calculated the related mortality, which used to be shown by the previous study. But in this study, we have shown, as I just mentioned, the impact on the average life expectancy of residents in China. So our findings shows that the carbon neutrality pathway could help increase the average life expectancy of Chinese people by almost 1 to 2.8 years in 2060. So what does it mean? 1 to 3 years of life expectancy increase? It is equivalent to about 5 to 10 years of public health efforts in China. So if we asked the National Health Commission to improve the life expectancy for Chinese people by 1 year, it will take them almost 5 years to finish so. So it shows how large the carbon neutrality is improving people's health in China. And that implies that carbon neutrality is something that relates to each one of us. And if we can help with the carbon neutrality goal, we will finally benefit from them. So I will stop here, and that's my presentation about the health impacts from climate change and carbon neutrality. And I also want you to remember that our health is closely related to the climate change trends in the world and also in the region that you currently live in. And if we could help with reducing carbon emissions, and that will finally lead to the health co-benefits to everyone of us, and not only to you, to your parents, and especially to your children. So we really need to work together to help achieve that goal. So that's the end of my presentation. And I really thank you for your participation and attention for this course. And then we will have this discussion session. So now I would like to invite all of you, if you have any questions in mind, don't be shy to ask your questions. And if you can open your camera and to ask your questions directly, that's even better. So I would say maybe some of you have needs to prepare something for your prepare some time for your questions. But I see two questions in the chat box. Let's start from the earlier one. If you could recommend, so it's raised by Erica. So she said, if it's a she, sorry if I'm wrong, if you could recommend only one change to our lifestyle to help reduce the detrimental effects of extreme weather, what would you propose? That's a really good question. I mean, changing our lifestyle, you can't really reduce the incidence of extreme weather. It's well, if we do really, if we make joint efforts to reduce the emissions, that will help reduce the effects of extreme weather. And if you would say one change to our lifestyle, it's hard to name just one, but I would name two if you allow me. So the first one would be using more public transportation to reduce our transportation related emissions, because you know a lot of, well, around 20% or 15 to 20% of emissions in China, and even a larger share of the emissions come from the transportation sector in developed countries. So that would be something that each one of us could involve in. And the second one is to reduce our emissions, is to reduce the food waste. Because just now we only focused on the carbon dioxide emission reduction, but you know, the food production and also the food waste also contributed a large share to the global emissions. So that's something we could easily do. But another part of the coin, or another side of the coin, is that imagine that we still have this global warming trend and we want to reduce the effects of extreme weather events. We actually, I'm suggesting everyone to prepare better skills to rescue yourself from those extreme weather events. If you are driving a car during the heavy precipitation, you should be aware that there are some regions or some roads or some areas that you should never go to, because they are having low latitude and they are easily to be buried by water. And if you are at home, and sometimes you can prepare more food and vegetables to prepare any unexpected extreme weather events, and that's something we have been